Hello, everybody. Welcome to another great episode of On the Air Sickled. My name is OD. I'm the executive director and host for On the Air Sickled, and we are jumping into our monthly segment called Dr. Simone Says with Dr. Simone Yuan. And this time, we're talking about what they think versus what's true, coming at you right now.
We've been told to tough it out, man up, push through. But how do you push through when the pain isn't just physical, it's emotional, it's mental, it's generational. We're told to be strong, but strength isn't silence, it's survival. It's waking up every day with invisible wounds and still choosing to keep going. Depression doesn't make us weak. Hiding it does. That's why the platform matters. That's why advocacy isn't optional, it's urgent.
Hey y'all, welcome back to the show. Again, I'm OD, Executive Director and host for On the Air Sickled, and it is my pleasure to bring to you another monthly segment of Dr. Simone Says. Again, we're talking about what they think versus what's true. All right, so before we jump in, I want to give you all the insight on our sponsorship for this show. So first up, we have our sponsor featuring Shift Humanity. Shift Humanity is something powerful that is coming to you all soon. Shift Humanity is by Grayson Sorrell, and this project, this book has launched. Pre-order the ebook now and help reach the goal of 200 copies by June 10th. And Shift Humanity, Graceland guides readers through an internal navigation system for a meaningful life, showing how adversity, faith, and authenticity shape our identity and influence the world around us. This book is a heartfelt journey of healing, purpose, and resilience. It's not just a message, it's a movement to ignite positive societal change. Be part of the shift today. Become a humanity shifter. Sign up for updates at GraysonSorrell.com and follow Graceland's social media at Graceland Sorrell. All right, and then next up is our sponsorship with the one and only Sickle Cell Medical Advocacy. Ladies and gentlemen, Sickle Cell Medical Advocacy with Dr. Simone Yuan. Sickle Cell Medical Advocacy stands as a nonprofit organization initiated by sickle cell patients and caregivers with a primary goal of dismantling the barriers that obstruct effective emergency room and hospital treatment for patients with sickle cell disease. SCMA is the only nonprofit to take a nationwide approach to sickle cell healthcare with curriculum-based training and patient education. Their unique approach to direct healthcare navigation trains volunteers like you and myself nationwide and pairs them with sickle cell disease patients to improve patient healthcare outcomes in real time. With over 60 plus trained healthcare navigators located across 23 states so far, don't fight the emergency room alone. Contact Sickle Cell Medical Advocacy today at www.sicklecellmedicaladvocacy.org. All right, ladies and gentlemen, we are going to jump right into the show. It has been my pleasure to constantly bring you Dr. Simone Yuan. She is not only an author, she is also a co-founder for Sickle Cell Medical Advocacy. She is the trainer for all of the navigators nationwide that stand out to support you. And today, she's going to be talking about a topic I think we all can relate. So without further ado, let's bring her on. Dr. Simone Yuan, welcome. You are live on the air.
To be here again. I look forward to this conversation. It's one that should have happened. It's a conversation that needs to happen. So I'm looking forward to the conversation.
Absolutely, 100%. So let's talk about this. What they think versus what's true. I asked you what we were going to talk about today, and you were talking about misconceptions that people often hear. In the hospital, they hear about us as warriors. And so let's talk about that. Common misconceptions of sickle cell patients. What's on your heart?
Well, I want to start with the fact that I think Black health is at risk, quite frankly. When we present for care and we're in pain, even Black maternal health, where, mom is in active labor and needs pain medication, studies have borne out time and time again that when we're in pain, we on average receive like 2/3 less of the pain medication that others receive. And there's a perception that we are somehow more tolerant to pain. Our skin is thicker, so we don't feel pain. And when it comes to sickle cell disease, it has its own, I believe it's spiritual. It has its own uh, intolerance that's just endemic. It's like ingrained in the medical culture, and it gets passed down. It gets passed down from doctors training other doctors and telling them these things that they then run with, and these stereotypes in the absence of any sort of formal training to combat that, it just perpetuates these stereotypes. And so we now have like a litany of things that nurses think about sickle cell patients when they present to the emergency room or when they're in the hospital, and doctors, and they will throw a sickle cell patient under the bus in a minute. It's amazing. I wonder if they don't remember that at the end of the day, forget about who that sickle cell person is. That is a body that was entrusted to them, and that body was entrusted to them for them to first do no. And I believe that that's mentally as well as physically. But somehow along the way, they have forgotten that. And when patients leave the hospital, sometimes they may be fixed physically, but harmed emotionally. And that harm may be bigger and they carry it longer. And so it inflicts more damage over the long haul than what they actually came for.
Mm-hmm, mm-hmm. Yeah, and you know what? It's interesting that you said that, because I always say, like, I work in healthcare, long-term care specifically, but when I'm orienting new staff members, I always say, it's important that we consider the actual, individual before we consider even their diagnosis sometimes. Because if you treat people the way you want to be treated at the end of the day, then you're going to always seek to give the best care possible, right?
Right.
And so, but yeah, no, I 100% agree. I mean, it's definitely can be a frustrating thing when you're communicating a certain way. We as patients are going to interpret that a certain way as well, and it's twofold.
It is twofold. I want to start with, from even presenting to the emergency room, right? So we're supposed to be seen and treated within an hour of being in the emergency room, but people will look at us and decide that we're not in as much pain as we claim that we are. And that one thing relegates us different level of priority when the nurse is making a decision. That one decision now determines how long it takes for us to get seen. And the difference between one level and another is drastic. So we were doing a review of of the emergency, the emergency procedure and how long it's supposed to take and all of that. And they had done a retrospective study, meaning they looked back at patients that they had treated and seen how, if they said they were urgent, how that went for them. And if they said that they weren't urgent, all with the sickle cell crisis. And the people that they said that were urgent, they were seen in like 65 minutes on average. The people that they looked at them and didn't believe them, they were waiting on average 178 minutes, which is close to 3 hours. It's like, it's 2 minutes away from 3 hours. 3 hours. Now, the difference between 1 hour of waiting with end organ damage or damage happening internally, the difference between 1 hour and 3 hours is a big deal, right? You came to the emergency room because the pain got to that level and you felt scared enough to come to the emergency room, and then you're left treated like that. And now I wish that I could say that 3 hours is what we normally hear, but unfortunately we hear about 6-8 hours, and people are in crisis, right? Mm-hmm. So their blood stopped in some vessel, it blocked, and there's no oxygen going downstream because that thing blocked. And all it needs is some intervention with some fluids, maybe to get things moving again, some pain management so that people can calm down and breathe and oxygenate, and which would widen their vessels, right? So instead, they leave that to happen for 6-8 hours. And then they wonder why it takes so long for someone to be discharged. If you have them sitting there and you damage them real good, like I said, heart attack and sickle cell are very, very similar in the physiology. With sickle cell, the vessel is getting blocked by sickled cells, right? In a heart attack, it's getting blocked by plaque, right? Whatever, cholesterol, whatever. But a blockage is a blockage, and downstream from that, if it's a vessel in the heart, downstream from that, if no oxygen is going to the tissue, all of a sudden that patient feels like an elephant on their chest. They're in the ER and they're rushing them through, right? They're like, oh, this person looks like they're having a heart attack. They're rushing them through because there is a blockage, and they understand that blockage needs to be reversed quickly because they're going to lose precious tissue, right? With sickle cell, you don't even know which tissue is getting damaged. Sometimes it might be, the hand. Sometimes people come in and they're like, it's my chest. Well, the chest has a whole lot of stuff, right? So all of that time, you're having somebody sit there with potentially that vessel blocking the flow to their lungs, and then causing lung damage, more lung damage, which is what happened to me, by the way, right? More lung damage because you stayed way longer than you should have, and the vessels were blocked way longer than they needed to. And by the time you got rescued, the tissue was dead, right? But it's on the inside, so nobody sees. And so they think that, oh, the patient is okay, but they're not. They see a patient sitting there waiting. And if the patient is on the phone, now we teach people, if you're in a lot of pain, you should try to distract yourself. You should, because we want you to not be thinking about the pain, because pain makes you not breathe deeply. You splint. And when you don't breathe deeply, you're not taking in oxygen, which you need, right then, and you're not blowing off the carbon dioxide, which actually constricts blood vessels. So we need to get that off. It also makes the whole body acidic, which causes more sickling. So we need to breathe. Okay, now you could be trying to distract yourself, sitting there, maybe doodling on your phone, trying to zone out because you're waiting for, and somebody will walk by and they have a choice. They have a choice of going, I don't know what they're doing, so let me not make an opinion, or making an opinion and having it be a good one. Like, you know what? Maybe I didn't see what I saw, and he's actually doing something related to his sickle cell.
Mm-hmm.
Or, you know what? They're doing something bad. They're doing something bad. Matter of fact, they're doing something so bad they don't even belong. In fact, they're not even in a crisis. They're just here for some pain medication, and they're not even in a crisis. And that's why they're able to just sit there and play with their phone. Now, you could be calling people to pick up your child because you couldn't make it to pick the child up at school because you got sick. You don't exist by yourself. You exist in a network. So when you separate from that network, you have people that you're accountable to, right? You may have to call your boss and say, I'm so sorry, I'm in a crisis. I'm heading to the emergency room. It doesn't look good for tomorrow. I just want to give you a heads up.
Or today.
Exactly, right? It could be any of those things, but for whatever reason, they will see that. And just because of built-in racism, built-in discrimination, they will see that and opt to think negatively about it, just automatically. And that then puts you at risk. The sad part is their negative opinion matters because they're in a place of authority. And that puts your health at risk. Suddenly, your health is at risk. Their perception is affecting your health.
Yeah. No, I'm reflecting as you're speaking on just how that has happened to me so many times, and it's frustrating because you're there to receive help. You're there to receive support. Right. And like you said, distracting yourself. For me, I remember going to the hospital and I would sing gospel music, and I would be in the emergency room. And that's when, there are still hospitals like this, but that's where, I would be just divided between another patient and a curtain, completely
right.
And I would be singing in pain. I remember when I would, be on my phone. I like watching movies. So I'll put on a movie real quick on my phone. We talk about scrolling on social media. People like to read, and I think the level at which we as sickle cell patients, like that next level that we go into, we don't tap into it thoughtfully. It just kind of happens where we're just like, okay, I know I have to wait X amount of time. I know that they're not going to see me. I know that they're going to probably put me behind somebody else, right? And so you have to kind of figure out, okay, what can I do in this
mentally
in the meantime to try to, keep calm and not blow up on people, because it's
right. because that has a stereotype too.
Yeah.
So now we're rude. We're considered rude. We're considered
rude, angry.
Yes, the angry black man, angry black woman. I had a nurse tell me, she just came in like she's entitled, telling me that she needs to be seen within an hour. I said, ma'am, that's not her being entitled. That's the actual guidelines, the national guidelines from the National Institutes of Health, the American Society of Hematology, the American College of Emergency Physicians, all say that with sickle cell, when they present in a crisis, that they should be seen and treated within the hour.
Yeah.
within 1 hour of arrival. And now she's asking the nurse to enforce it. And the nurse says she is acting entitled, right?
Mm-hmm.
And so it's like, wow, you something that you should actually have now is being seen as you being antagonistic, or you I always tell people, and I tell this to a lot of the, in fact, right now we have a navigator class going. There's a young lady in there that said that 2 years ago she met me because she was the nurse of one of my patients here in Florida, and that the patient was very sick, and that somehow the hospitalist was not wanting to call us back. So she called the nurse, she called us back, and that she never forget what I said to her. She said, "You told me," because the patient was not wanting to go home, and they're like, "Oh, well, you're not, your pain is better, go home." It's like, so what I explained to her, I said, the body is like a house.
Mm-hmm.
And if your house burned down, right, and you call the fire people and they out the fire, is your house livable? And she's like, no. I said, well, what happened? What needs to happen? She's like, it needs to be rebuilt. I said, exactly. Her house just got burned down. You were the fire people. You outed the fire, right? You outed the pain. You got the pain under control. But her house is still burnt down. It still needs to be rebuilt.
Yeah.
And so if she's saying I can't go home, is because she doesn't know how to grab all the pieces of her burnt down house and walk out the door. She may need a few days where it gets built up just a little so she can get out the door. But you can't just expect that just because, the pain went down, or, oh, the labs look fine now today. It was looking bad yesterday, but it looks fine now today. So you must be okay. So get out the door. And they just assume that we want to stay there, when who wants to stay there? We have big, beautiful lives. I was in medical school when this was happening, to me. And I've watched it happen in the sickle cell community over. It's like I see all these people and they're speaking my story. And I'm like, this is crazy that this is happening over and over and over. And there are people who are they're just trying to live. They just want to go back to their life. It may not be, it may not be all put together like someone else's life, but it's theirs. And they want it, and they want to go back to it. So if they're saying I can't go back yet, it's because something is broken. You haven't fixed something. And the thing is, they never assume that the problem could be their perspective. It never dawns on anyone like, maybe I'm looking at this wrong, right? Maybe the person who's screaming and asking for medication and demanding it right now, maybe they really are in that much pain. Because after all, if I were like in surgery and someone started cutting me open, but they didn't give me any anesthesia, would I be polite to the anesthesiologist or the surgeon? Would I be like, excuse me, but I'm in blazing pain because you just cut me open and there's no anesthesia. When you have some time, if you could afford it, could you please give me some anesthesia? And that's not how you're going to do. You go, no, I want it now. That's what you're going to do. That's how you're going to respond, right? But then when you respond like that, they say, oh, you're so angry. Oh, you're so aggressive. And they don't stop to just put themselves in your shoes. Now, let me say this. There are plenty of wonderful doctors. I had some of them that treated me for my sickle cell. I have one of them right now. I know I walk in, I give her a hug and I kiss on the cheek. She kisses me on the cheek. I mean, she will readily say, I don't know everything about sickle cell, but teach, kind of like, tell me what's new. And
Yeah.
I understand that I'm pretty much teaching my my hematologist, but at least she's willing to be taught, right? She's willing to listen. She has her own set of education, but she's willing to listen to how I need to be treated. Now, I do believe in part it's because I am a medical doctor, right? I did train to be a medical doctor. I might be retired, but I did train to be a medical doctor, so people understand that I have that body of knowledge and I'm operating in that when I say something is happening to me. So they're more likely to take something, seriously. But the sad part is that there are a lot of patients that need to be heard just like that. And they don't have the degree behind their name,
Yeah.
but they still deserve to be heard and they're not.
Yeah. So, Dr. Simone, tell me then, how, I mean, not me personally, but how would I'm in pain. I'm hearing you, I'm supposed to be seen within the hour, all right, don't be outrageous in the, put on the show and everything like that. Try to speak respectfully. I'm in agonizing pain. Who would want to speak, calmly, respectfully in such a moment, right? What am I to do in that space where it is I have the knowledge, I know the law, I know the, and NIH, I know the guidelines, the ASH, I know all of this, but the person triaging me, as much education as they may have, does not know any of this. The doctor doesn't know any of this. And I'm not in a place where I can call a navigator. What is there for me to do? My family doesn't understand because I'm the only one with sickle cell. What am I to do? And I think that this is the common question that I'm hearing now is, no one understands. No one,
Right,
as
right.
many people that are affected by sickle cell disease, no one understands. And I can relate to that because I used to say, my family would see me in a crisis and all they can do is respond in the moment, but they're not feeling what I'm feeling. I remember when I was in the crisis and my brother had to carry me to the car and drive me to the hospital, right? I have so many stories of that where my own wife have had to drag me across the floor just so that the paramedics can get to me on time, right? And so no one feels what we feel. And so I just want to kind of slow this down a little bit and talk about we're in this space. I understand. I know because I have sickle cell how much they misunderstand me. What am I to do now?
Well, there are a couple of things. What you said is very layered, right? And we will forever be needing to educate as we go. We can't afford to stop educating. There's a class running right now called the Empowered Patient course or Empowered Patient Training. We think we know sometimes the language that we need to use, and oftentimes we don't have the language. And when we are advocating for ourselves, we think, oh, well, we've been doing this for a lot of years. But you can work hard or you can work smart. And what we're teaching people is to work smart. You don't always have to work hard where you're antagonizing them and you're cussing them out and all of this stuff. There are ways that you can work smart. I'm teaching people how to report inadequate care, right? From the ER to inside the hospital to outside the hospital, and to keep a paper trail for accountability. because a lot of times people get upset. They say they've been mistreated, but they don't document it. They don't write anything. They don't do anything. They don't put paper to pen. And so there is no paper trail. A lot of times they don't even realize that they themselves need to be educated, right? The second part is the navigator course. I know you said in that space that you don't have the space for a navigator. And so that is a problem. When you don't have a navigator, that is a problem. That's a problem we are trying to confront right now. We have 91 and counting, 91 navigators and counting. We have a class right now of 23 people. It's supposed to be 30, but it's 23 people. And so come May 25th, we'll be over 100 navigators, but there's so many more navigators. We have 50 states, right? And each state is big, right? I mean, 100 navigators could manage for just the state of Florida alone. So we have work to do. And we need to keep educating the people that are treating us. So I know it's a lot. I know it's a lot to have to bring a little binder to say, here, can you see, this is what it says. Please, can you help me make this happen? Because I'm otherwise going to suffer a lot of damage if you don't. There's a lot of work to be done to get there, and I think times because there's a lot of work to be done, we can just throw our hands up in despair. But I think about ants, right? Ants, one ant, nothing. But ants together are mighty. Ants together tear down houses, right? Break down walls, right? And that's because they're operating consistently and together. And that's what we need, because one day we will look up and the system will have changed because we were persistent and we were together. And because we were persistent and together, we became a force that brought down the pillars that currently stand and things for the better. But we have to be willing to put in the work.
I agree. And there is definitely work for us to do, from legislation to, education. There's just so much that, we as warriors, we have power. We just don't know our own power. And so if we could come together, like you said, and be able to come up with a plan that's effective for everyone, right? Bridging the gap to those that are in the hospital, to those that are just, going to their physicians for checkups. If we can just bridge the gap one doctor at a time, it's going to be a journey. It's going to be a fight, but it is not impossible.
It isn't impossible. And you know what? It's probably going to happen sooner than you think, because the truth is if we really, and it doesn't have to be a perfect plan. If we wait for a perfect plan, we're going to miss it.
Yeah.
We have to be willing to fail forward. We have to be willing to try something and it didn't work, but we learned from it, and we learned that if we implemented it this way this time, that it might work a little better, and we keep failing forward, right?
Yeah.
Because that is still progress. Yeah. Someone said something to me the other day. They said, all these people that we look up to, heroes of old, right? When they were living their lives day to day, they didn't think of themselves as heroes. Maybe some days they even sat down and said, you know what, I give up. I don't want to do this. But we don't know that. Yeah. What we know is the end result. And we see the end result, and it's mighty. And we think that they just magically appeared from beginning to end, and they were just brave the entire time. They knew what they were doing the entire time, and they arrived at that solution. And the truth is, their journey was probably more zigzag than you can imagine. It wasn't a straight road at all. But
Yeah.
that's what heroes look like. Heroes are people who say, I want to try to change something. I don't know how, but I'm going to put one foot in front of the other, and I'm going to fight. And one day they look up and somebody's calling them a hero, and they don't even know how they got there.
Yeah.
Right?
Yeah.
So, yeah.
Yeah, heroes will definitely show up in places that you wouldn't even expect. You know?
Yeah. Yeah.
So I want to close things out here. So let's talk a little bit. We're in the middle of the Healthcare Navigator course currently. And so the Healthcare Navigator course is 10 weeks, 10 weeks, something like that.
Yes, 10 weeks.
What is the date for the graduation?
The date for the graduation is May 25th.
Okay.
So yeah, May 25th at 5:00 is going to be the graduation. And the patient empowerment or the empowered patient course, we had our orientation today, and class start officially next Saturday. So if people wanted to, check out the empowered patient course, let me say this, it's actually closed for people outside of Florida for now. We've closed the seats for non-Florida. We had a certain amount of funding, and so we could only do so much for non-Florida, and then the rest was Florida because the grant was from Florida. And so if someone's in Florida, they're in luck. So this year, for the first time, we get all these goodies to give to people because of the Florida grant, right? So we get to give them a $50 Visa gift card, and my 2 best-selling books, and and the advocacy binder, and they get their certificates of completion, the T-shirt, on, right? So it's an exciting time. And even the navigators that are graduating, when they graduate from the Florida navigators, they get the same thing too. Like they got, we were able to make a deal where we included all of that, and they said yes. And so we're able to give all of that to the student. And I love that, because I'm like, wow, I didn't know I could ask for stuff for my students and my navigators. That's great. Now that's all I'm gonna do is ask for stuff for my navigators.
Well, yes, ladies and gentlemen. So there you have it. So if you haven't gotten a copy of Dr. Simone's book, there's All Rise.
Thank you, Omar. Always with a copy.
Make sure that you get a copy of this. If you have questions about navigating the medical institution, you definitely want to get a copy of this book. And then Dr. Simone's personal story. Here you go. A Doctor in a Patient's Body. Yes. These books you can get off of Amazon, correct, Dr. Simone?
Oh, don't give Jeff Bezos my money. He's got enough money. He going to space.
I'll tell you what. Why don't y'all go ahead and contact Sickle Cell Medical Advocacy.
That's right.
You can connect with Sickle Cell Medical Advocacy at www.sicklecellmedicaladvocacy.org. On there, you'll have the opportunity, if you go to that website, to not only sign up for the Healthcare Navigator course, sign up for the Empowered Patient training course, but you can also fill out a form, and you can be assigned a healthcare navigator where you don't have to fight the medical institution by yourself. All right. Dr. Simone, thank you so much for joining us. Is there anything else that you would like to share before we close out?
No, I just want to say, if there are any providers out there listening, I know that there are good providers. I've had them in my time, and all we ask for is to remember that we are, for everybody else, I always say, don't treat the disease, treat the patient. But for sickle cell, the treatment of patients are so bad that I say, don't treat the patient, treat the disease. There's a body in front of you that needs to be treated. And you said first, do no harm. So someone is paying for that body to be saved. And I pray that you remember that that body is just as good a body as any other body to be saved.
Thank you, Dr. Simone. Powerful, powerful statement. Ladies and gentlemen, that is Dr. Simone Yuan, and you have been listening to this segment of Dr. Simone Says, this episode called What They Think versus What's True. Dr. Simone, until next month, I'm going to put you into the green room and we'll connect right after.
Sounds good.
All right, ladies and gentlemen, you've been listening to On the Air Sickle. Listen, if you have been enjoying this segment of Dr. Simone Says, this is not the first, and this certainly won't be the last time that you can hear directly from Dr. Simone about what's on her heart and what her thoughts are regarding the medical institution and our healthcare system, and the things that we can do as warriors to improve our health. If you would like to share your story on the Air Sickle, please go to www.ontheairsickled.com. Make sure that you add that D at the end there. And you can also fill out a form there. Connect with our team. They will pull your form, review it, present it to, we'll discuss it, present it to me, and then they'll reach out to you to schedule you an opportunity. Also, if you go to that website, we have new gear. As you can see, I am wearing my On the Air Sickled hoodie, which I typically wear when doing the show and doing community work. But now we also have a jersey. We have it in white and black material, On the Air Sickled. And on the back of it, it has warrior and the number 1, meaning if you are a warrior, you know what position you're in. All right, so you can get that on the website, www.ontheairsickled.com. Also, if you would like to give to On the Air Sickled, any monetary gift of any kind, please make sure that you donate to us. We have a 3-layered vision. The 3-layered vision is on your screen there for continued growth and development of all things. I know that you might be sitting back and enjoying all of the material that we offer to you, but this stuff does cost money, and money does move mountains and makes missions happen. Also, to support sickle cell research, listen, there's a lot of changes that's happening in the world today, and we want to make sure that we are investing back into the things, into the ideas, the thoughts, the science behind what makes us great people in society, as well as what makes us healthy, right? So your monetary gift of any kind goes to our opportunity to try to give back for sickle cell research and development and education, such as what Dr. Simone does, educating community people like you and me to be able to navigate the healthcare system. And then lastly, the Flip the Bill campaign is a campaign that I have been trying to get off the ground. I want to be able to give back to the warriors that are working hard to provide for their families. Let's say that you're unable to provide for your family this week because you're stuck in the hospital, right? You're losing out on a paycheck. Maybe you're not able to pay that copay that you have to see that doctor for. If you become a guest on our show, you apply for the Flip the Bill campaign, our board of directors will review it, get you on the show for you to tell your story, and you might have the opportunity to receive some money back from On the Air Sickle to be able to put food on the table for your loved ones this week, or maybe even pay for that copay for that hospital visit, whatever the case may be. Flip the Bill campaign, we want to take it over and support you the best way that we can. Please donate. You can donate to PayPal at On the Air Sickled OD. All right. Any monetary gift of any kind. All right. And I think that is all that I have for you. Make sure that you all don't miss a single episode of On the Air Sickled. Watch us on YouTube. Hit that notification button and don't miss anything that we have to update you on. If you go to www.sicklecell, go to www.onairsickled.com. You can also get our monthly newsletters. Find out what's going on with On the Air Sickled, where we're headed next, what our projects are. Juneteenth is coming up. That is also World Sickle Cell Day. They got something special planned for that, so I'm excited. So make sure that you all are paying attention to all of our announcements. Join the fight, continue to be strong, and stay educated, stay warm. Make sure you're taking your medication if you're on medication. Make sure you're working out if you need to. Change that diet if that'll help you. Please, please, please take care of yourself, ladies and gentlemen. You're listening to On the Air Sickled. My name's OD. Be strong.